Hello, DLI students, faculty, and staff. As part of National Preparedness Month, and more importantly, as we move into the flu season, we all need to take simple but critical steps to ensure that we and our families stay healthy. Please listen closely as General Martin Dempsey, Commanding General of the U.S. Army Training and Doctrine Command, and Colonel Karen O'Brien, the TRADOC surgeon, discuss tips to prevent the spread of the flu and H1N1 vaccine procedures. Remember, prevention is the best medicine. Keep in mind, it's a team effort.
I'm General Martin Dempsey, Commanding General of the United States Army Training and Doctrine Command, and I'd like to spend a few moments speaking with you about the H1N1 pandemic influenza, which potentially could threaten the health of our Army, to include our families if we do not understand the virus and practice thoughtful preventative measures. Each year we're faced with a challenge of the annual flu, which typically infects about 20% of the United States population. In fact, it hospitalizes approximately 200,000 people a year and contributes to 36,000 deaths. This year, however, in addition to the annual flu, we'll be faced with the possibility of a pandemic H1N1 virus outbreak, and it's imperative that you proactively take preventative measures against that virus, against both viruses, to help protect you and your family. A pandemic influenza such as H1N1 is an aggressive global outbreak. History shows us that pandemic flu is serious business. The so-called Spanish flu of 1918 claimed 680,000 lives, including 46,000 soldiers in just a year's time. Likewise, the Asian flu of 1957 took 70,000 lives, and the Hong Kong flu of 1968 killed 34,000 people. H1N1 has already proven to be a lethal adversary, having claimed nearly 500 lives across multiple countries in just 3 months. We do not yet have enough vaccine to protect our entire force against these flus, and while we expect to deliver the vaccine this fall, the supply will be limited initially. Our countermeasure must be prevention. It starts with setting and enforcing medically effective standard hygiene practices, frequent hand washing, covering faces while coughing or sneezing, and using head-to-toe bunking for our barracks and tight quarters. This is a mission-critical issue that I expect commanders and senior non-commissioned officers to take the lead to ensure the health of our formations and their families. I expect leaders to include flu consideration in all risk assessment and mitigation plans for every operation or task, from training events to social gatherings. Leaders should work closely with local medical treatment facilities to identify flu cases and rapidly implement isolation procedures if necessary. Other considerations may include rescheduling or even redesigning training to reduce the potential for spreading the H1N1 flu virus. We face an immediate challenge with the H1N1 pandemic flu virus combined with the annual flu season. But with simple preventative measures, we can mitigate its potential effects on ourselves and on our families. I've asked my chief surgeon, Colonel Karen O'Brien, to follow me and offer additional details on the H1N1 flu virus and various preventative measures. Thank you, and let's take care of this great institution, our soldiers, and the United States Army.
Hand hygiene is one of the most effective things that we can do to prevent respiratory illness. Studies have shown that washing your hands 5 times a day can reduce your chance of getting an infection by as much as 40%. The way you wash your hands properly is you want to use warm water for at least 15 to 30 seconds and rub your hands well with soap during that time. One thing to consider having soldiers do is recite something such as the Soldier's Creed or the Warrior Ethos while they wash their hands, and this will ensure that they wash their hands for the necessary amount of time to be effective. In the event that you're not able to access running water, another effective hand hygiene technique is to use alcohol-based hand gel. And we have bottles available for issue to soldiers, and these can also be purchased at any drugstore. This hand gel can reduce lost duty time by over 40% and reduce medical visits by over 30%. So they are also very effective at preventing illness. Another effective hand hygiene technique is to ensure that you don't touch your hands to your face or eyes. And finally, if you have to cough or sneeze, ensure that you cover your mouth and nose with the sleeve of your jacket. Please do not use your hands, because then you touch things such as doorknobs and elevator buttons or other surfaces that other people might come into contact, and they may become ill also. Symptoms that may suggest that you have flu-like illness might include fever, aching muscles, sore throat, cough, or sneezing. If you experience any of these symptoms, it's important that you avoid going around other people and that you seek medical attention so that you can ensure that you are isolated from others and don't infect others in your workplace. If you are ill and you start to recover and then you develop fever and worsening symptoms again, you should also seek medical attention at that point. Other symptoms that would indicate that you need to seek medical attention again might include chest pain, the sudden onset of dizziness, or shortness of breath. So in summary, we are facing pandemic H1N1 influenza. The disease is going to reemerge when school starts and start to peak in the September-October timeframe. And this is going to be before our vaccine becomes available. Until that vaccine becomes available, it's going to be paramount that everyone does their part to prevent disease transmission by following hand hygiene and these other techniques that we have described. This is going to be critical for our Army, for our families, and for our entire civilian and Army team.
Seasonal flu vaccines will be available beginning on the 21st of September. Units and departments will be notified of the immunization schedule for you and your families. When the H1N1 vaccine becomes available, the same notification process will be followed. If you or your families have any further questions, feel free to contact the Presidio of Monterey Army Health Clinic at 831-242-6820. Help keep yourself and your family healthy by making these preventive measures a part of your permanent daily routine.